Hello, dear students and my dear friends. Welcome you all to my channel, Nursing Concepts by Raghav. So, in the today's video, we will discuss a very important topic and most commonly and routinely seen and a procedure. So, regarding that, we will discuss, and even you can expect an question in the nursing competitive exams as well. So, if you are an student or you are working in the clinical settings or you are preparing for the competitive exams, so this topic is you can consider as an high yield topic for the upcoming competitive exams. So hope with the thumbnail you must know the topic name, so that is central venous catheterization. So we have discussed the peripheral venous catheterization. So if you want to watch that video, so the description I have given it in the link I have given, so you can watch that video. So in this video we will discuss the concept of central venous catheterization. Okay, तो चलिए शुरू करते हैं बिना देरी। तो आज के वीडियो शुरू करेंगे। तो अगर आप पहली बार वीडियो देख रहे हैं तो वीडियो को एंड तक जरूर देखना एंड सब्सक्राइब करना मत भूलना। एंड if you watch till the end and if you like the video then click on the like button। तो चलिए शुरू करते हैं आज के वीडियो और आज के टॉपिक, दैट इज सेंट्रल वेनस कैथेटराइजेशन। तो पहले देखते हैं कि सेंट्रल वेनस कैथेटराइजेशन क्या होता है। सी एंड इन व्हाट वे इट इज डिफरेंट विद द पेरिफेरल वेनस catheterization. In the peripheral venous catheterization, we insert the catheter. Catheter is nothing but we can say the a tube. Okay, so that we insert into the veins in the peripheral veins. Central venous catheterization, as the name itself indicates, central means, here is central. Central means the veins which are located at the center of the body. So in those veins we insert a catheter. So that procedure we call it as a central venous catheterization. Okay, central venous catheterization. So in the peripheral venous catheterization we insert a very small catheter into the peripheral veins, whereas central venous we insert a catheter into the large veins, especially which are located at the center of the body. Okay, so means they are quite very close related to the heart, we can say. So in those larger veins we do catheterization, or we do insert a catheter. That procedure we call it as a central venous catheterization. Okay, so here is the definition. It is an insertion of a catheter into the large central vein. So the most commonly used central veins are the internal jugular vein, subclavian vein, and the femoral vein. So why do we need to do this central venous catheterization when we have an peripheral venous catheterization? See, in some patients where the peripheral venous or the peripheral veins or the IV access is not possible, or it is very difficult to get the peripheral veins catheterization, or in the case if the a patient requires a long-term venous uh, treatment like a long-term therapy, or patient is dependent on the IV fluids and all, or the required TPN, then rapid blood transfusions and all. So in such cases we do a central venous catheterization preferably than the peripheral venous catheterization. So this is all about the introduction to the central venous catheterization. So then what common sites we use? So as in the definition I have told, the most commonly used site is the internal jugular vein. So this is the internal jugular vein. So this is considered to be the most commonly used. Okay, remember, so this is most commonly used. Many times it's been asked which is the most commonest venous or the vein that has been used for the CVP or the central venous catheterization. So this is easy to compress, and under ultrasound guidance we can do this easy insertion into the internal jugular vein. And the second most common is the subclavian artery. The second most common is the subclavian artery. See, this is quite comfortable to the patient and has a lower risk but high risk of pneumothorax. See, because it is quite near to the, means we are inserting the this vein comes near to the lungs, so there is a damage of the pleural cavity, or you may injure the pleural cavity, so that air leak may occur and air may enter into the pleural space and leading to the pneumothorax. So this is considered to be the high risk for pneumothorax. So, but patient is quite comfortable with this CVP. And the third one is a femoral vein. The femoral vein is like it is being commonly used in the case of emergency. Remember, the most commonly used central vein for the CVP during emergency is the femoral vein. So, but it has a very higher risk of infection. So, as this is quite near to the periphery, that is what the perineum. So, it is having the higher risk of infection, and even the bleeding chances is also more, and thrombosis can also occur with this condition or with this central venous catheterization. So these three are the most commonly used sites for the CVP. Okay, so remember, so most common is the IJV, and the next is the subclavian. Okay, in the picture we can see here. See here. So this is on subclavian. Okay, so here is an internal. This one is an internal jugular. This is internal jugular, and here down is the femoral vein. So then what are the types of CVP? Okay, there were different types of central venous catheters are available. So in that, the first one is a non-tunneled CVC, where this has been used for the short-term use. Okay, under when the patient needs less than 2 weeks of IV management, so then we go with the non-tunneled CVC. Then we have a peripherally inserted central venous catheters. So this is being used for a longer period up to 1 year when the patient requires an home management. So in that condition, we can go with the peripherally inserted central catheters. So this has been inserted through the arm of veins. Then another we have is a tunneled CVC, tunneled central venous catheterization, where this is being inserted under the skin. Okay, for more than 2 weeks surgically. This will be inserted surgically under the skin. So when the patient requires more than 2 weeks of IV management, then we can go with the tunneled CVC, but most commonly we use the non-tunneled CVC. Then the subcute implants, or we call it as implanted ports. So these are implanted, means implant means we will keep under the, say here in the subcutaneous tissue, we will keep these ports. They will have a venous access. So this has been used for the long term access, like more than 3 months. So it is having the very lower risk because it has been completely implanted in the subcutaneous tissue with the venous access. So this is what we call it as a port. We usually commonly call it as a port. In the chemo patients, you might have seen this. We call it as a chemo ports. Okay, so they are subcutaneous ports or implanted ports. So they will have a venous access. So then now you can see the pictures here. So this is a peripheral inserted central venous catheter. So there they will use in the arm veins. Then we have a central venous catheter with the 3 ports here. Then subcutaneous port. See here you can see in the picture. This is a port. Yeah, so it's been inserted in the subcutaneous tissue. So here is an HD cath or hemodialysis cath. So this is also used. This is also a type of the HD, that is central venous catheter. So then what are the complications? See, this is very important. So what complications might occur with the CVP? So the complications can be, one thing is related to the, that is mechanical complication, means related to the insertion, and second is after insertion it is related to the catheter. So two important complications can occur. So these mechanical are, means like while insertion, these are the immediate complications, whereas after insertion, so the many complications will occur, they are delayed. Okay, over a period of time these complications will develop. So the immediate complication, so the first one is a atrial puncture. See, as these large veins are being located at the center of the body or towards the center, so they are beside the arteries. Okay, so sometimes what happens, while you insert the catheter into the veins, you may injure or you may puncture the arteries. So there they you can see the a very heavy bleeding can be seen, and they will form the hematomas. Okay, so accidental puncture to the arteries can lead to hematoma formation and or the bleeding. Then the hematoma formation. Second is the hematoma. So that is as I told. So you may damage the other blood vessels also while inserting, so can lead to the bleeding. Then pneumothorax, very important. So recently, even the I think in the NORCET 9 also this question has been asked. Pneumothorax, the most common complication of central venous catheterization. So that is pneumothorax. So pneumothorax, as I told, that is a subclavian artery. So when the uh, see here what happens here when the catheter is being inserted into, or while inserting the catheter into the subclavian artery, so it may damage the lung and the chest wall, may damage the lung and the chest wall, causing the air to leak or air to enter into the that is a pleural space, leading to the pneumothorax. So this is a very most common complications related to the central venous catheterization, especially with the subclavian arteries, subclavian venous or the veins or the jugular approaches. Then the another complication is the malposition. See, sometimes what happens, the tip may be placed in an inappropriate way or in appropriate place. So then what is the proper uh, position for the catheter tip? See here we have a two catheter tip positions here. So catheter tip positions for catheter tip. So one is the SVC, that is superior vena cava, and second one is the that is KO atrial junction. KO atrial junction. Okay, KO atrial junction. The KO atrial junction means where the superior vena cava touches the superior wall of the right atrium. So that portion. Okay, so you can see here. I will draw a diagram here. Consider this is an heart. Okay, so this is the right atrium. See, this is an SVC, superior vena cava. So this portion, so where it touches the superior wall of the right atrium, so this position we call it as a CAJ, KO atrial junction. So this, the catheter tip should come here or else either in the superior vena cava. So this is considered to be the a proper placement of the catheter. So this can be confirmed with the X-ray. So this is very important. You may get an MCQ over this, which is an a proper tip position or the a place or the position for the catheter tip. So remember CAJ. And this will use an proper pressure monitoring also. Then the next complication is the cardiac arrhythmias. So as the you are inserting the guided wire, it may touches the heart and leading to the abnormal electrical activity in the heart. So leading to an arrhythmias. So that is also common complication. Then venous injuries. So you may damage the veins, leading to the laceration or perforations can also be seen. So these are all the immediate. While inserting, these can happen. Then after the insertion, so these are related to the catheter catheter related infections. So these are delayed complications. So in that, the first one is the local site. At the site of insertion, you may see the infection signs like redness, swelling, pus. So these all things can, or the pain, all these symptoms will uh, makes that the site is infected. So then CLABSI, catheter related bloodstream infections. So this is and one of the hospital acquired infection, HAI, hospital acquired infection. So this is the most common acquired infection after the that is a urinary catheter or catheter infections. So this is a second one, that is catheter related bloodstream infection. So we call it as a CLABSI. Then sepsis, it may cause us the sepsis. Okay, once the catheter get infection, the blood it will circulate in the bloodstream, so then it can cause the sepsis. Then air embolism. Okay, so sometimes while giving an medications, so there is a possibility of air entry into the catheter, leading to an air embolism. So these are the most common complications related to the CVC, central venous catheterization. Remember this pneumothorax. See here, let's see what are the common uses of an central venous catheter. See, as I told, the most commonly it has been as an IV access. So it has been used for the sampling, administration of the medication, administration of the IV fluids, then blood transfusions, then even the CVP monitoring, central venous pressure monitoring. So all these are the major purposes of using the central venous catheter. So here most commonly in the hospital we use the 3-port or the triple lumen catheter. What we use is the triple lumen catheter. So we have a different sizes of catheter here, triple lumen, even the double lumen catheter also we use, but most commonly used is the triple lumen catheter. So you might be seen in the patient, especially in the ICUs or even the high dependency units. So there you can see this commonly, this triple lumen central venous catheter. Say it has some colors with the ports. Okay, these are called as a ports or the uh, IV lumens or the port. So one is a blue color, then brown color, and one is a white color. So these are being used for different purposes. So here this white is will go to the proximal means it will opens at the proximal. So proximal means towards at the end. So that is why it is most commonly used for the blood sampling. So white is, it is an 18 gauge, most commonly used for the blood sampling. This is called as a proximal port. Then the second one is a mid, and even it has been used for the blood transfusions and even for the administration of the medication. That is non-irritant medications are being used in the white port, this port. Then medial port, that is a blue color one. Okay, so this is a blue color. So this is also been used for the TPN, that is total parenteral nutrition. Then IV fluid administration means majorly used for the IV of fluids. Then this is also even, next is the distal port, that is a brown one. This is being used for the CVP monitoring, central venous pressure monitoring, and even it is used for the administration of the chemo medications, and even for the rapid, as this is a larger bore catheter or the lumen, you can use it for the administration of the large amount of the fluids in the case of emergencies, or even for the rapid blood transfusions we can go with this port. So these are the very important things as a clinical aspect. You must remember this white, blue, and the brown one. So next is, what is our role? Okay, how do you take care of a patient with a central venous catheter? So very important thing is we have to prevent the a complication, that is a delayed complication. So while insertion, we are not going to insert the catheter. So the doctors usually do that. So but once it is being done, the procedure is done. So we have to take care to prevent the delayed complications. So first thing is we have to prevent the infection by proper hand hygiene technique. So while handling the central venous catheter CVC, so before and after we have to do the hand wash. Then dressing. So we have to change the dressing. So we use the two types of dressing here. One is a transparent dressing, or else sometimes the routinely, that is a gauze dressing we will use. So if it is a gauze dressing, then for every 2 days, if it is a gauze dressing, every 2 days we have to remove it. And if it is a transparent, then for every 7 day we have to remove the dressing. So this is very important uh, for 2 days or sooner. Means if it is get soiled, then now a visible dirt or the infection, if you say seen like, then it can be changed before 2 days also. Then the flushing, we have to keep the port or the lumen patent. So for that, what you have to do is daily we have to uh, flush. Okay, flush technique, that is 10 ml syringe we have to use. Saline and the heparin should be used for the flushing. Okay, then we have to scrub the ports before and after each excess, means we have to clean the ports. Then skin antisepsis, so 2% chlorhexidine or the alcohol solution to be used while dressing. Then monitoring the site for the infection, we have to observe the site for any signs of infection like swelling, redness, pain, then pus formation. So those all things should be monitored at the site. Then catheter and the tubing change will be done as if needed or as per the tubing protocol. Then patient activity precautions. So when the patient is having the CVC line in position, so we have to avoid some activities like submerging. Submerging means it is like taking bath and all. Then sharp objects or pulling it, the catheters, these all things will be avoided. So these will causes the bleeding and all, or the displacement of the catheter. So out of all these things, you must remember these you can consider it as a bundle of care in the hospital prevention, hospital acquired infection prevention. So this is bundle care. Bundle care for prevention of CLABSI. Okay, central line associated bloodstream infections. So bundle care, that is the guidelines given to prevent the infections related to the central line associated bloodstream infections, that it is an HAI. HAI, that is hospital acquired infections. So at the last, what points you have to remember for the exams? So that whole concept I have discussed here, but these points you must remember. See here, the preferred site in the adults is a jugular vein. Preferred site is right internal jugular vein, because it is quite straight, it will reaches the superior vena cava. Then preferred site in the case of emergency, that I have told, a femoral vein. So and this is very commonly it is being getting infection. So it is most common, not being commonly used. Only in the case of emergency we use this femoral vein. Then tip position, as I told. So there are two sides. One is a lower superior vena cava or cavo-atrial junction. So this is, as I told, where the superior vena cava meets the atria, or in the it touches the superior wall of the right atrium. So this will helps to assess the or monitor the central venous pressure. Then how do you confirm the CP position? So this is being confirmed by chest X-ray or a fluoroscopy. Then best way to prevent the infection is a strict sepsis, then chlorhexidine and daily line care. And most common complication is pneumothorax. Then dressing change for every 2 days in the case of gauze dressing, and for every 7 days in the case of transparent dressing. So these are all the very important key points. Before you go for an exam, just have a look over these points and make a revision, so that you will never forget these points in the exams. So definitely you may strike with this any of these questions. So that's all for today's session, and even you may get an image based question. Okay, IBQ. So image based question can also come with this also. Okay, image based questions, anything is possible here. So just remember these images as well. So hope the today's concept is clear, and if you like the video, so क्या करना है, like the hit button, uh, hit the like button, and then share it with your friends, those who are preparing for the competitive exams, and even for your friends those who are working in the clinical settings, and for the students, so that they can also have an idea and knowledge related to the central venous catheter. So that's all for the today's session and today's video. So we'll see you in the next video with an again amazing topic. So till then, take care and keep studying. Thank you.